Every technique, every therapy, every tool has its intended use, has its area of excellence, has its area of absolute uniqueness and limitations. Colourpuncture is no different. And today I would like to just touch on the subject of limitation colourpuncture because there are no absolute limitations, there are no absolute contraindication to colourpuncture, but there are some areas of caution and there are some areas where we do need to consider early on working with somebody else, a medical professional or a psychologist who is trained with that. So how and when do we stop and reassess our strategy with our colourpuncture limitations? So I would like to talk about emotions, feelings, and medically complex diseases. So emotions are probably the simplest in structure, not in experience, but in structure construct which we are dealing with. Because emotions are really clearly defined physiological responses, which in case of acute emotions, because there is a situation of acute emotion, which is something part of our normal physiology response, our response to the situation which is happening at the moment. So, for example, if you are presented with a situation of immediate danger to you or to your family or to people who are close to you, you naturally react with fear automatically because this is a situation of real danger. And then there is a situation when there is emotion of grief, when we lose our relatives or people dear to us. Then situations of anger, when we are, for example, witnessing something which goes totally against our values, especially in situations when we cannot do much. So those are examples of acute or natural emotional responses, which are normal, which are physiological, and which are automatic reaction, which are supposed to put us in some kind of emotion, because emotion just means call for action. And call for action could be very different in case of different emotions. And this is important to understand. But generally, we can learn about emotions, we can learn structure of emotions, and we can make a list of what sort of actions we can choose as our intentional response when we feel this emotion or that emotion, depending on the situation. And there are situations of emotional indulgences when we typically habitually indulge into some kind of emotion, when we dwell on some emotion. And this could be something which is explained by our early life conditioning, something which is runs in the family, or this could actually signal underlying problem with a related organ. In traditional Chinese medicine and acupuncture, we are dealing with physical diseases directly with emotions, accompanying emotions at the same time, energies of this organ, and so on. So there is no difference in between the two. And there is some medical research to back it up. Because, for example, in case of biliary dyskinesia, when our gallbladder cannot quite release the bile into the bile ducts, there are reports that people can experience anxiety or depression of totally unexplainable origin. And the reason is totally physiological, even though this is a transient state, this is not a organic pathology as such, but it still affects obviously the functions, and there are medical counterparts, there are physical reactions to that, but there is also the psychological, emotional counterpart. So in the situation when there is a medically presented sort of symptoms like that, then we need to really consult the doctor or Chinese medical professional, because they're really trained in recognizing how particular emotion contribute to function of organ and so on. However, in Colourpuncture itself, we have beautiful tools. Our 5 elements Colourpuncture, one of my favorite Colourpuncture sort of therapies or set of treatments for the body and soul, because this is so targeted. This is so quick to access, because we are tapping directly through the emotion into the function of related organ, and both improve. Our physical symptoms improve and our emotional response improve, and this is really beautiful. However, if, for example, you diligently did all your 5 elements Colourpuncture, which is based on 5 elements acupuncture, you did your preparation treatments on the body, you did your shadow ear on shadow microsystem, ear and shadow ear, You did your gray colors, gray fills on your vertebras, and things are moving, but not to the full resolutions. And probably this is the time to refer your patient on, or to self-refer if you use color puncture for self-care. I would say generally with emotional responses is our sort of capacities to limitation ratio would be 80, 90, depending on your trained color puncture against 20 or 10% respectively, depending how well you're trained. With emotions, it's very important also to use our emotions, both intentionally. So, for example, once, as I mentioned, we decide what kind of emotional response we can choose instead of our automatic reactions, which probably we just inherited from our parents or people close to us, or influential people or whatever was in our immediate environment, which we just absorbed, and so we read emotional responses and we modeled after people in our surroundings. And then we also need to use emotions as sort of measure of our progress. And this is something which could be very beautiful when your patient says it, and this is normally the first thing they notice. They say, I was presented with the same situation, but I reacted completely differently. I experienced emotion, but I reacted differently, or my emotional response wasn't that high. Or they can say, I just found myself responding in words, in behavior from a completely different place. So Colourpuncture excels in that totally areas of strength. We can absolutely, most of the time, can help ourselves and our patients with emotions. All it takes is observation, learning emotional structures, learning appropriate actions needed, and intentional use. And as I said, in some rare cases, you can refer your patient on. So from emotions, we're moving into feelings. Feelings are way more complex than emotions because feelings normally involve emotions, associations, very often rigid associations from the past, which we formed again in our sort of, it's a result of our early life conditioning. It could be memories, it could be sort of all sort of situational responses, which we picked up as we went through the life, learning how to deal with emotionally challenging situations. So feelings are complex. And for me, it's easy to talk about it because I was reading really good depth psychology books since I was probably a teenager. I learned psychology as a part of my training at uni as a biologist. So for me, it's intuitive to use certain psychological tools. However, if you're not so trained, do not attempt to use them because you don't want to mislead your patient into something that you don't fully understand. I would only like to stop here at what is called association and related topic for emotional bridges. Emotional bridge is something that triggers our past experience by something which we experience in the moment. So there is some trigger. So, for example, there is a person who says something or does something or visually represents somebody from our past with whom or with the situation we had a very strong emotional association. It could be positive, it could be negative, it doesn't matter. What happens? Because our mind operates very often by associations, and so immediately, instantly, without us fully understanding what's going on, we travel through this emotional bridge to the situation in the past. And depending on the situation in the past, which we automatically compare with situation at hand, although it might be completely different, we either experience a very negative feelings and turmoil and negative emotions, strong emotions, or something very positive. We expect something very positive from this situation or this new person or this new job or new town or whatever, only because we experienced something similar in the past, which reminds us by association. This is something which is fairly poorly understood in general, but it happens all the time, and we just need to recognize that this is happening. We do all have emotional bridges, and we travel along emotional bridges every day during our entire life. This is again, this is another excellent area of Colourpuncture because Colourpuncture can actually absolutely uniquely, not just area of excellence, but I would say area of uniqueness of Colourpuncture because Colourpuncture can highlight, it can bring to light, so to speak, situations which we didn't even know were important. And then we can recognize emotional bridges, we recognize our pattern of response, our automatic response, and then we can obviously either go back and in our mind's eye, we can see what we could have done differently had we have the power or knowledge or recognition or support back then, or what we can do in our current situation to make it better based on our new understanding how we react, what emotional bridge was, what was the situation again, and how it all could have been done differently. And also maybe taking a moment of two, if situation is really strong in terms of feelings, to see how we could have developed differently if we handled the situation in the past differently. So, for example, if there was a complex situation in childhood and some part of us didn't get developed, imagine you can go back, imagine you can get help and resource from people in power, from yourself now, from any imaginary powerful figure, how you could have developed differently, how you could entire life unfolded if that situation would have handled differently. But obviously, as I said, you need to have certain psychology background for this. If you're not sure how to use those tools, I can share simple tools I use, which you don't need much of a background. You need just to have a keen interest, and you need to have responsibility for yourself if this is yourself, or you need to have a responsible patient. However, in situations of complex feelings, I would say recognize and leave it to psychologists or work with psychologists, because color puncture, another way to describe color puncture for the soul, if you wish, not body color puncture, but color puncture for the soul, not for physical present diseases, but for our emotions and feelings and our soul life, is color puncture not color puncture is a non-verbal psychology. So color puncture does its part, absolutely. However, there are some people who are so deeply close, they feel something in the body, but it remains on a stage of very vague feelings or felt senses. And sometimes you can help them, again, if you're properly trained. Sometimes you need to refer them to psychologists if the situation was so complex, and especially if there was some trauma in early life, then they might need to work with psychologists. But generally, I would say this is area of excellence and absolute uniqueness of color puncture. 50-50. In certain situations, it does depend heavily on your personal background as a therapist, because many therapists are trained in several modalities. So if you feel that you have appropriate training, psychology, counseling, other areas, if you feel that the patient is very responsive, then you can handle it with obviously using also higher therapy of color puncture, such as conflict resolution and so on. Ask me if you're not sure. And in complex situation, when you feel that there is initial response, but then you are hitting some kind of a wall, then you might consider referring them on. It will be the best thing you can do. And the last but not the least is this is a huge area of medically complex diseases. And when I'm talking about medically complex diseases, we talk about situations when, for example, there is a true medical complex disease, such as any disease which involves tissue degeneration, or which normally would have taken years to develop, and a multitude of very different factors, including nutritional deficiencies, emotional problems, toxicity, genetic predispositions, certain lifestyle choices, and so on. So it's very hard to resolve them with any one therapy. And even orthodox medicine has its limitation here. So we're talking about degenerative diseases, systemic diseases, this kind of stuff, systemic arthritis, polyarthritis, all systemic diseases, neuropathy, cancer, this kind of diseases. Very often, these patients need proper medical attention, proper diagnosis, proper medical treatment routine, medications very often, at least as the first stage. And then then you need to work with somebody who is skilled in nutritional protocols, detoxification protocols, and so on. You can absolutely support them with the body. And in this situation, color puncture could be invaluable because, again, because of conflict resolution family of treatment, because with every degenerative treatment, there is a huge emotional counterpart to it. I was lucky enough to be trained at some point. It was very temporary training, but it was extremely illuminated with an integrative doctor. And one of the things he said to our students back then, he said, never ever attempt to treat complex diseases just with herbs, just with nutrition, just one thing, and never also leave it to just orthodox medicine, because chances are that patients will get better before they realize what actually brought them to this disease, or what kind of deep emotional conflict, unresolved conflict, which created this nest of pain, absolutely constant spiritual pain, very often very deep in the body. And then, obviously, when your patient is looking into that, and this is where you can absolutely help with Colourpuncture, then everything else will take on completely different flavor, completely different tone, because this will be true holistic care. So in situation of truly complex medical diseases, do not waste time, you and your patients, because this time could be valuable in case of strong diseases. Work with integrative doctor, work with other health professionals, whatever is appropriate. Encourage your patient to go to medical doctor if they haven't already, because very often people come to alternative therapists feeling that this sort of subtle and more softer and more natural therapies can provide all the answers. Sometimes they can, sometimes they can't provide the only answer. And in these situations, you need to recognize, you need to encourage them to go to tests, to keep to their medical appointment, to take their medications for as long as needed, and so on. Be responsible here, be absolutely responsible. Second situation is situation of trauma, and it could be childhood trauma, such childhood abuse, abandonment, severe cases of abandonment in childhood, or any cases in any moment, any period of life which gave rise to post-traumatic stress disorder. So you really need to know what you're doing. Again, they need to work with somebody, not just with you, with psychologist, with somebody who is professionally trained. They need to know their stuff. They need to use the skills that their psychologist or counselor taught them, without any doubt, because there is a huge program to overcome trauma and so on. But again, Colourpuncture anti-trauma therapies can provide absolutely invaluable part of healing here, because Colourpuncture can tap and soften these areas which we never knew existed, which will support us to go all the way with whatever program there is. So this kind of cases, PTSD, childhood abuse, early, very, very severe early condition beatings, and so on. And the third area here is complex medications. Sometimes medical issue could be not so difficult or strong or big or severe or degenerative. Sometimes people just start taking medications, and a lot of them, and they pick up new medications without thinking much about it, either because they don't want to do any other work. So, for example, they don't want to make changes to their diet because this is difficult. They love their food, but they rather take a tablet to correct their whatever levels in on their blood tests. And then there is another one, and then there is a side effect of this, and then we see medication for another thing, and so on. And so this can amount to really complex cocktail of medications, and you really need to know what you're dealing with. So this is one area of it. Another area of it, you need to be careful when, and you need to absolutely work with medical doctor when you work with people who, for example, taking medications for immunosuppression. Antidepressants also fall into this gray category, because Colourpuncture is a natural therapy, same as acupuncture, same as every other natural therapy, as simple as massage in effect on the body, aims to restore the balance of energy, qi, and blood in traditional Chinese medicine language. And so functioning of all our organs and organ systems. And for example, if a particular medication, such as in case of immunodepressants or certain antidepressants, they're aimed to suppress a particular function for a particular reason, you really need to know what you're doing, and you absolutely have to. It's your responsibility as a therapist, or it's your responsibility if you use Colourpuncture for self-care. to consult with the doctor and make sure that what you're doing is not in contradiction with the main medical treatment. So this is the area which you need to be really skilled and versed and trained to, otherwise just leave it to professionals, because this is very, very important. So I hope it helps, and take a moment to reflect. What was your most recent challenging case? Or what was your own situation which you feel like Colourpuncture didn't do 100% of what you expected to do? Did it fall in any of these categories? Complex emotions, emotional indulgences, typically automatic emotional responses, complex feelings, or any of these medically complex diseases, medications, PTSD, and so on. Take a moment to reflect. Take a moment to reflect, is in your health or in your patient which you dealt with recently, for example, your patient you treated last before watching this video, quite literally. What was the situation? Was there any medically complex situation? Is there any medically complex situation in your case which you need to probably just make an appointment with your doctor and start doing something, start doing the tests, start aiming to diagnose what is wrong, and then you can decide what kind of um, alternative, orthodox, complementary care you may choose. What is your emotional bridge? What is the most recent emotional bridge that you traveled over to from your situation in present, triggered by somebody or something, to the past? What was the emotional bridge? And what emotional indulgence? Or what do you feel you're habitually indulging into? Which emotion, in other words, you experience more often without even realizing it? Look at yourself in the mirror, see your expression. Very often our wrinkles, the whole facial expression will tell us what it is. Good luck with your Colourpuncture. Any questions, let me know. I'm here to support you.